I have the honor of introducing Julie Gunther. She is from Spark MD in Boise, Idaho, and she started her DPC practice in September 2014.
It's May.
May 2014, excuse me. That was September.
Thank you, Ken.
You're welcome. There you go. That's okay.
That's my 20 seconds.
For inviting me to speak. So I'm a board certified family doctor and Idaho native, and I opened Spark MD in this building in 2014. And actually, I'm going to do 2 talks in 10 minutes today because we're not talking about what I think we need to talk about. So where was I? Okay, so I was asked to kind of speak about how I built a small micro practice as a solo doc from scratch with $200K in debt and no resources other than my husband has a full-time job in under 3 years. I have 540 patients. I do want a lot more patients, but I need help at this point. I think Ken actually just gave you all those pearls. So I'm gonna race through this, and I've asked Hint to make my speaker's notes available. So this is our clinic. What I want the doctors here to take away is if you have a vision, if it's small, if it's big, you can do it. You can buy a building, you can lease a building, you can hook up some cart to the back of a bike. You need an iPhone, a stethoscope, and your board certification or your training. That's all you need to be a good doctor. Okay, we can make this so much more complicated. It isn't. I'm known for 2 things, authenticity and cursing, which I think go together. So, sorry, Zach's looking mortified right now. So, so how many of you feel like this or recently felt like this at your job? Yeah. Yeah, we're all real. I didn't make this. I stole it off of Facebook. But if you feel like this, you don't have to feel like this anymore. If you feel like you're crazy, you're not. And that's why you need to surround yourself with other people who understand this industry is broken. Because the first thing it will help is your language. And the second thing it will help is your mental health. Number 3, what's this? Anyone know? This is falling water, a house built on top of a rock on top of a waterfall. You need to have a vision. If you don't have a vision, you're not going to make a damn thing. You need to see what you want, and you need to then map out how to get it. Have a vision. Have a mentor. This is my mentor. Many people know this gentleman. This is Josh Umber. He set the standard in DPC for basically raising the bar in healthcare through mentorship without charging. That creates some challenges for businesses. I don't frankly care who your mentor is, but find someone who's doing what you want to do, who's saying things that make sense to you, and who's successful, and then call them, email them, go to their clinic. And then I would encourage mentors to be transparent. If you've been open 2 months and you're not profitable yet, tell people that, because people are basing life decisions on what you're telling them works. Take an index of what you have. What do you have and what you need? Is there a patient that's willing to give you $400,000 as seed money to start up your clinic? Do your parents own a strip mall that's half empty that you can lease space? Do you have $200,000 in medical debt, 2 small children in private school, and a house that you don't really want that's too expensive? That was my situation. But you're a damn good writer and you convince a bank to give you money. My situation, right? You have something and you need something. And if your vision is incongruent with what you have and what you need, you're going to fail. You need to learn to jump off cliffs. You're never going to be ready. You need an LLC, but you have to have an address. You don't have an address because you don't have an LLC. You need a website, but you don't know what you're going to call yourself, and you don't know how to buy a URL. All of us have been there, and you just get ready, lay the groundwork as best you can with your vision and your inventory of assets and liabilities, and then you jump. Ray Bradbury said, and there's some business guy that's been credited this, but Ray Bradbury said, jump off the cliff and build your wings on the way down. There's a point where you just have to jump. This is a horrible graph. I hate it. Someone challenged me that this wasn't real. So that's this little micrograph. That's the journal it actually came from. What is this? The growth of physicians in our country, the dark red, and the growth of administrators. Why is healthcare expensive? When I see a patient and the patient pays for my care, it has to pay this layer. This is our problem. We cannot recreate this in a different way. So all of the business people in the room, I challenge you, you better bring value to the table if you want to set foot in my clinic. Trim the bonsai. Once you start growing, you don't have to do the same thing. Look at your vision and adjust. Someone just told me you shouldn't be doing the same thing on day 1,000 that you're doing on day 1, right? That's not progress. So don't feel bad editing your practice, editing what you offer, changing your website, changing your resources, okay? And I have to credit Ryan Newhoffel for that. He told me, Julie, trim the bonsai. Okay. And one of the last things, as you get growing, remember your vision. If your vision was good in the beginning, it sets the groundwork for your mission statement. People will come along and offer you all kinds of opportunities. Is it congruent with your vision? If it's not, move on. And number 4, show up every day. There's a saying that is that entrepreneurs are the only people who will work 80 hours a week to avoid working 40. I don't know how many people. Doctor entrepreneurs are the only people that will work 120 hours a week to avoid working 100. But you're going to get frustrated. My analogy for growing my practice has been these amazing little windows of, oh my gosh, we're there, we finally can afford a pill counter, and then, holy crap, I'm drowning, I just let someone down, and but you just keep moving forward. You show up every day and work towards that vision. So that's talk 1. Talk 2 is about patience, and it's about doctoring. And it's going to be a little bit self-appreciating, and those of you who know me know my ego's moderate to reasonable, I guess. Because I think all of the business and non-healthcare providers, non-physicians in this room need to understand what a doctor actually is. So how many people have had a year in their life where they've had more than 5 physician visits? Okay. So, like in that same calendar year. Okay. And if we exclude pregnancy. Okay. Those are the only people in the room who understand what it means to be profoundly ill, would be my contention. Last year I was diagnosed with breast cancer. I have a degree from Harvard. I have an amazingly supportive husband. I got my care in the system that I worked for. They lost my breast specimen. I was told, you're awfully stressed out, it's just chemo. There were questions about our intimate life that were only answered when we asked them that were kind of important, like, oh no, you can't expose him to the chemo. I had more than 2 visits scheduled that were rescheduled that I never consented to, so I got your visit on Thursday has been rescheduled, and I was like, I never agreed to that. The day I started chemo, they handed me a 16-visit schedule and said, here you go, those are your following visits. Well, I'd asked my oncologist, can I work through this? What do I do? Like, what do people do? Do they take 6 months off? Thank God I had a long-term disability plan. So not only did I start up a small DPC micro practice, but I did it and had cancer, and it's still open. So if we can do that, you can do it too. Now, but I'm sometimes kind of badass and most of the time not. But what I want to talk about though is when we talk about healthcare being a failure and healthcare being catastrophic and healthcare being expensive, what we mean is when I go out of town for a week and my patient gets treated for pneumonia at an urgent care and then dies, what if I had seen her? When my patient of 8 years was dying and I just got out of the hospital for anaphylaxis, which is when your airway tries to close up, and my mom drove me an hour to her house so I could lay next to her and say, it's okay, you can die. That is the work that family doctors, that is what primary care doctors do. So if you march into my space wanting to be a part of this, you better understand what it is. Because it's one of the most authentic things we have, and it is a catastrophe. And when you screw up a business in healthcare, people die. People's chemo gets delayed by 2 weeks. My 99-year-old grandfather called me short of breath. I called his doctor personally because we couldn't get through the clinic. His doctor said, I will have my nurse call him and get him in tomorrow. 3 days later, his neighbor drove him to the urgent care. 7 days later, he passed away. He was 99. But did he die because he was 99? Or did he die because our healthcare system is such shit that a 99-year-old can't get a visit with their primary care doctor? So, this is what direct care is. What direct care is doctors saying, I can't morally do this, that is my calling, this way anymore, because the real consequences of it are too much. So we can talk payment models, we can talk tech, we can talk communities, we can talk whatever, but when the rubber hits the road, the work that we do is life-altering. So this is why direct care matters. This is the direct care value proposition. It is one-on-one, affordable, real care, because you care about people. There, I did it. Thank you. 2 talks, 10 minutes.